get started here about 1 minute early. My name is Brett Mooney. Thanks for joining us. I've got Vicki Madigan with Madigan Insurance Group here with me today. Vicki's a health insurance and Medicare specialist, and her office is actually located in Huntley, Illinois. Today, Vicki's going to shed some light on some considerations we should make as you guys are going in to make some decisions around health insurance and your Medicare options. We will be recording this call and releasing it out to everybody via email. At the end, we might have a few minutes for open question and answer, but we're going to all give you an opportunity to schedule a time with Vicki to ask her any questions that you have, or if you want to email myself or anybody at Mooney Lyons, we'd be happy to introduce you. So Vicki, thanks again for joining our call. I'll go ahead and pull up your presentation for you and share your screen, and then we can get started here.
Well, good morning. My name is Vicki Madigan, and I own Madigan Insurance Group Incorporated in Huntley, Illinois. I do have a team of agents in my office that are also certified as well as clerical persons to help you. As you can see on the screen, our address is in Huntley. Our phone number is 847-457-1802. And general information or questions can be sent to the email on your screen, which is the word support@madiganins.com. A little bit about me. I've been doing Medicare insurance since about 2011. Prior to that, I have a career in corporate training and public education. Okay, so this is a disclaimer that we have to post for CMS. CMS is Center for Medicare and Medicaid Services. It says we do not offer every plan in your area, and any information we provide is limited to the plans that we do offer in your area. And you can always contact Medicare.gov or 1-800-Medicare to get information on all of your options. Can I put the taskbar down at the bottom?
Mm-hmm.
Thank you. Okay, so today we're going to be learning the basics of Medicare. There are parts of Medicare and plans in Medicare. So we're going to be looking at Medicare Part A, B, C, and D, and understanding the choices for Medicare. There we go. I'm getting some technological help today. Okay, so this is our agenda. What's Medicare? Who is eligible for Medicare? What are your coverage options? When can you enroll? And that's very important because there's very specific dates for enrollment. What are the steps that you need to take? And then where can you find more information? Okay, let's first start with who is eligible for Medicare. Someone who is a United States citizen or a legal resident for at least 5 consecutive years. There's a myth a lot in our communities that if we have a loved one, an older loved one that's in another country, and we want to bring them to live with us here in the US, that because they're over 65, that they would automatically get Medicare. And then they're very disappointed to learn that the person had to be a legal resident for at least 5 consecutive years. So then what happens to those aging persons is they end up on Medicaid instead of Medicare. Now, you can be under age 65 to qualify for Medicare. And many people don't know that if you are younger than 65 and you have a qualifying disability, you can apply to the Social Security Administration for disability insurance. And once you have disability insurance for greater than 24 months, so on month 25, you then become eligible for Medicare. Any person with a diagnosis of end-stage renal disease, which is kidney disease, or ALS, is also eligible for Medicare. So what are your coverage options? If you look at the circles, you see that there are parts of Medicare, and then you see the Medicare supplements. So a little bit about the history of Medicare. It was brought to us by Lyndon Johnson in 1965 with the Social Security Act. And when he created the Medicare health system, he used alphabetical characters to define everything. But he used preceding words of part or plan. So you'll hear me talk about alphabetical characters A to N, and then I'll tell you it's part A or plan A. There's a very big difference between the part and the plan. Okay, so if you're getting ready to turn Medicare eligible, like you're turning 65, or you recently applied for Part B of Medicare, or you've had those 24 months on disability, the very first thing to do if you're turning 65 is you start at the Social Security Administration. This form that I'm showing on the PowerPoint now is available on our website. So you go to socialsecurity.gov and you go fill out an application for Medicare. And one of the common mistakes that people do when they're filling out this form is they not only apply for Medicare Part A and B, but they apply for their Social Security retirement benefits, and they had not intended to do that. So one of the things we can help you with is show you which buttons to push on the application to make sure that you get health care or you get health care and retirement money. All right, so then once you get the ID card or the letter from Medicare stating that you have a Medicare ID number, then you can bring that to our office and we can help you enroll in a plan. So you'll just look at this slide for a little bit. You'll see there are two pathways. I call them roads. The road on the left is your original Medicare, Medicare Part A and B, a standalone prescription drug, and then a Medicare supplement some people call a Medigap plan. That is how we got Medicare in 1965, kind of an a la carte menu where you've got 3 different ID cards in your wallet. The Medicare Part D and the Medicare supplement are provided by a private insurance carrier, not necessarily the same company for your Part D and your Medicare supplement. This lane of original Medicare does have what's called fixed costs. So Medicare Part A, if you've worked your 40 quarter hours, will have a $0 premium. Medicare Part B, if you qualify for the standard premium for calendar year 2024, is $174.70. And then you will have a premium and copays for Part D, and you will have a premium and possibly copays or deductibles for a Medicare supplement. One of the benefits of staying in the road of original Medicare is it is not managed care. As long as your provider, your healthcare provider, has a contract with Medicare, you can see any Medicare provider. This lane also has a downside, meaning that you cannot go outside the United States. And we have a lot of people who've currently been in Medicare for a period of time did not realize that if they go to Canada or they go on a cruise, that they have lost their Medicare insurance once they've left the United States. But we have a solution to that too at Madigan Insurance Group we can help you with. Okay, Medicare Advantage plans, which are Part C, which is where you see a lot of commercials for infomercials on YouTube and other places on TV. As you can see, it says that Part C combines the Medicare Part A, Part B, and Part D. So in this lane, you have one ID card. And you have plans, as you'll see, like HMOs and PPOs. And this is managed care, which could be subject to a referral if it's an HMO. And both HMOs and PPOs are subject to prior authorizations. All right, so these are some definitions for insurance. I'm sure all of you have some kind of insurance right now, and you'll get a medical service, and then you get an explanation of benefits. And then you're like, well, what's the difference between a deductible, a copay, a coinsurance? And where I'm going to focus really quickly right here is on copay and coinsurance. Some healthcare insurance plans have both a copay amount and a coinsurance. In the Medicare world, a copay might be $20 to see a primary doctor, and the word copay associate with a dollar sign. It's a flat dollar amount. For the contracted year, it will not change. Coinsurance is a percentage, like your original Medicare card is 80/20. Okay, so you could have copays and coinsurances in the same plan. All right, let's talk about the Part B premium. The Part B premium is either deducted from the Social Security check prior to your direct deposit. And in order to have the direct deposit of your Social Security check, you have to be taking your Social Security retirement monies. So if you're not receiving your Social Security income at this time, you will get a bill in the mail from Medicare to mail a quarterly payment to Social Security. Every year, the standard Part B premium changes. For this year, it's $174.70. The last sentence on my slide here is about IRMA. She's not a lady and she's not your friend. It stands for Income-Related Monthly Allowable Adjustment, and is based on income, and it's based on your modified adjusted gross income from 2 years ago. And if you have an IRMA penalty, you will have gotten a notice from Social Security that your Part B premium is greater than the $174.70. And I'll deflect back to Brett to answer any questions for you later about IRMA, since that's his expertise. All right, let's talk about the parts of Medicare. Part A is hospital insurance. On the red, white, and blue card, it'll say hospital, it'll say Part A, and then there will be a date. Medicare always begins the first of the month. So even if your birthday, like mine, is the 31st of the month, it will start on day 1 of the month of your birth. And it only covers 5 different things. It covers inpatient hospital care, inpatient mental health, skilled nursing or rehab services, hospice care, whether you're at home or in a facility, and some blood transfusions. How I like to keep this in my mind, it goes with statuses. So when you're admitted to a facility or you use health insurance, you have a status. You're inpatient, you're outpatient, or you're in observation. And the Part A equals inpatient. If you look at the A, associate it with the word admitted. Part A equals admitted to a facility, you're pretty sick, you're not getting out of bed. The next is Part B. This is for outpatient services. So if you're using Part B services, your healthcare status is outpatient. You have doctor and outpatient visits, which is like your doctor appointments. You go to a hospital for an x-ray or a lab, then you go home. You use behavioral health. You go to a drugstore and purchase a wheelchair, oxygen, a cane. Your doctor orders physical or occupational or speech language or cardiac rehab therapy. And then your preventative care. And a side note is Medicare will give you 23 no-charge preventative care services. Now I've got the emergency room highlighted in red because a lot of people think, well, that ambulance or my loved one drove me to the emergency room, and the emergency room is located in the hospital. So this should be under Part A. It is not. It is Medicare Part B. And you don't go to Part A unless you go from the emergency room to an admitted status. So the next thing says, and observation. Observation is up to 24 hours when deemed medically necessary by a doctor. If you are in observation, you need to know that status because you're technically in outpatient status. And if you need to go to a skilled nursing facility or a rehab unit, you have to go from Medicare Part B observation to Medicare Part A and stay in the hospital 3 24-hour periods before you can go to the skilled nursing facility, or Medicare will not pay your bill. So let's talk about what the red, white, and blue card with Medicare Part A and B does not cover. Both Medicare Part A and B have deductibles, that coinsurance I was telling you about, and the premium you pay to own Part A and B. What is an excess charge? So that is the amount billed over what Medicare agrees to pay. So excess charges could be your bill's $1,000, Medicare approves $800, who pays the other $200? You cannot be charged more than 15% of the difference. So you could not, in my example, be charged more than 15% of the $200. Now, there are many Medicare supplements and Medicare Advantage plans that cover that. We'll get to that in a minute. But if you're just on the red, white, and blue card, you have financial responsibility for Part B excess charges. The red, white, and blue original Medicare card does not cover prescription drug coverage. It does not cover any hearing benefits, vision benefits, or dental. It does not cover long-term care or custodial care if that's the only care you need. And when you end up in a nursing home or a long-term care facility, long care, your status changes from Medicare to custodial care. Okay, these are the 2024 deductibles and co-insurance for original Medicare. So again, we're just talking about you having the original Medicare card. We haven't gotten to supplements or other plans that can help protect you financially. If you read in the Medicare and You book, the deductible for 2024 for Medicare Part A is $1,632 for the calendar year. Now you'll notice the next sentence says that this deductible can renew during the calendar year. And on the next slide, I will give you the Medicare definition of a benefit period. So the little story that goes with this, if you're injured or hurt and you go in a hospital admitted status at the first of the year, and maybe you're there 2 or 3 days. So let's say you go home on January 4th, you've paid that deductible for the beginning of the calendar year. Now, you will have no new deductible until about March 5th of the calendar year, given however many days are in February for that year. So what happens between your discharge on January 4th and let's call it March 5th is if you get another admitted status for the same condition or a different condition, you have no new deductible. But if March 7th comes and you trip and fall again and you go back in the hospital, you have another new deductible. So at the end of the day, for a calendar year, 365 days in a calendar year, this deductible can renew about 7 times, which is leaving you way over $10,000 in out-of-pocket cost, which is why it's important when you're eligible to enroll in a Medicare supplement or to enroll in a Medicare Advantage plans. Now you've paid this deductible and you still are going to owe 20% of the Medicare approved cost. And we see this plummeting people into great financial risk and debt if they only have a red, white, and blue Medicare Part A and B. Now, Medicare Part B has a deductible, which also changes every year, but it is only one time a year. That is for Medicare B outpatient. That is $240 for this calendar year. You would also have a 20% coinsurance of Medicare approved costs. And like many other insurance plans you've seen for healthcare who have out-of-pocket limits or caps, the original Medicare card has no maximum out-of-pocket or cap. This is a quick definition, which you can find in the Medicare and You book, about how a benefit period is viewed when they're reviewing your claim, and that is what we just discussed. Okay, let's talk about some Medicare supplement plans. What do Medicare supplement plans do? Think of them as the bucket underneath original red, white, and blue Medicare. So all of those financial expenses that original Medicare doesn't cover, your Medicare supplement plan will absorb some of those costs. So it does help cover some of what Medicare A and B does not. It is offered only by private insurance companies. And here's where I was telling you, we have more alphabetical characters, but now we're saying plan, not part. So the plans of Medicare supplements are letters A to N, and they do have a high deductible plan F and a plan G. I'll show you on the next slide a chart so you can see that the benefits vary by plan. And of course, the more coverage, the higher your premium. If any of you listening today are living in Massachusetts, Minnesota, and Wisconsin, They have different standardized plans than all of the other states. Being in Illinois, in my office in Northern Illinois, I am licensed in Wisconsin. And so I do write quite a bit of business in Wisconsin and can explain to you personally how Medicare supplements work in Wisconsin. Okay, at the bottom of your screen, you see this macro law of 2020. So many of you have family members, grandparents, older parents that had Medicare supplement plan letter F. It's kind of the Cadillac. It paid 100% of all the coverages, leaving no cost sharing to consumers. So in 2020, the macro law, which was over 2,000 pages, decided on the consumer end to take away Medicare supplement plans F, C, and D. Now, if your loved one was enrolled in that plan or you were enrolled in that plan, you are grandfathered to keep Medicare supplement plans C, D, and F. However, you're going to see a greater percentage of increase as your premium changes yearly than persons in, let's say, a Plan G or a Plan N. The other thing the macro law did for us was to protect our identity. Prior to the macro law, your Social Security number was your Medicare number. If I have anybody listening today that still has that original Medicare card with your Social Security number on it, you should have received a new one with a bunch of numbers and letters that do not identify you. If you try to show your Medicare card at a healthcare provider, the old one with the Social Security number on it, your claims will be denied. So you can always go to Medicare.gov to request a new Medicare ID card if you don't have a current one. All right, so here's the chart I was telling you about, okay? So this graph, we're gonna teach you how to read it. Find the word benefit on your screen. Look at the left-hand column. So the left-hand column under benefits are the charges from Medicare, like a Medicare Part A or B deductible, okay? And then if you look across where you have the alphabetical letters, you will notice that no major brand of an insurance company is listed there. You just have your letters A to N. That's because, let's pick on Plan G for a second. If you are enrolled in a Medicare supplement or a Medigap Plan G, and you live in Illinois or you live in Iowa or Indiana, that Plan G is going to pay the same for, let's just say you go get your appendix out. So if you got 3 people in a room, they're all on Plan G, they all go to the hospital and get their appendix out. Whatever that approved amount is from Medicare, that's what's get paid. Because these Medicare supplements, they're federally regulated. Kind of hard for a lot of my customers and consumers to grasp that because we're used to marketing and branding and commercials, telling us if we do this, this will be a better product. But in Medicare supplements, what matters when you choose a Medicare supplement is the premium that you start with, because that premium is going to have increases which are compounded, and the rate of return. And from all the customers I've worked with over the years, I've been told that we have some proprietary software that they've not seen with other agents. So if you were with us and we were showing you the quote for, let's say, a Medicare Plan G, and let's say eight different carriers came up with different pricing, we can then also show you the market analytics, which show you how that's going to increase as you age. So maybe you pay $2 or $3 more a month to start with, but as you age, you have a 0.03% increase versus a 6.2% increase. That's part of the services that we offer to help you make sure you get the most comprehensive coverage at the lowest cost. What do you need to do to be eligible for Medicare supplement insurance plans? Okay, think of your red, white, and blue original Medicare card like the key to your car. If you don't have that key or that fob, you're not going anywhere, and you cannot enroll in any type of a Medicare supplement, drug plan, or Medicare Advantage plan without first having Medicare Part A and B. Then you need to be the resident of the state in which you are applying for coverage. So why is that important? Well, I live and my office is near a 55 and older community. So many of those residents have a resident in the state of Illinois, but they may have a secondary residency in Florida, Georgia, Arizona. So how do I know where to write their Medicare supplement? So your Medicare supplement for the state of residence is, what does your driver's license say? You're 6 months in Florida, you're 6 months in Illinois. Do you have an Illinois driver's license or do you have a Florida driver's license? Whatever your driver's license says is where we write your policy. Okay? People with disabilities under age 65 can also, as I said at the beginning, apply for a Medicare supplement, and anybody with end-stage kidney disease. Excuse me a sec. All right, so now I'm going to talk to you about drug plans, Medicare Part D, and that helps with the cost of prescription drugs. Again, like Medicare supplements, they're offered through private insurance carriers. Your prescription drug coverage varies from plan to plan. They do have catastrophic categories that will protect you from very high drug costs, and your benefits can change each year. When you enroll in a Medicare Part D, there's a list of drugs that is covered by each plan. That is called a formulary. Think of it like a dictionary, alphabetically A to Z, with a list of the drugs. And you'll see in a minute what a tier is. There's a tier rating from 1 to 5. So if you're on a specific medicine, you want to look in that drug plan's formulary to make sure that that drug is covered. The list of drugs can change each year. So if you have a formulary from a Medicare Part D carrier that's, let's say, was 2023, you get a new medicine in 2024, you look in your old 2023, it's covered there, but then you go fill it and you find it's not covered in 2024. So one of the things that's very important to us to be of service to you is that we have an accurate and up-to-date medication list, specifically in the fall, so that after October 1st, we can check your list of medications and make sure the drug plan you're currently enrolled in, or that you will be enrolled in January, is still most appropriate and covers your medications. The last part is coverage. When you enroll in Medicare Part A and B, coverage into Part D is not automatic. And penalties will apply if you enroll late, and they will last your entire lifetime, and they hit you monthly. So I tell people, even if you don't take a vitamin or an aspirin or any kind of medication, you still need a Medicare drug plan to be compliant. All right, these are the tiers I was talking to you about. So they go from tier 1 to 5. So again, like I'm going to just pick on amoxicillin, a pretty basic antibiotic. Most of the carriers have that as a tier 1. It's a low dollar copay. So the lower the tier, the lower the cost. All right, this is a graphic our office came up with. The Medicare Part D yearly coverage process can be a bit confusing, especially if you're brand new to Medicare. And we get a lot of questions about this. So I'm going to spend a little bit of time here. And let's just start. We're going to make the year January 1 of 2024, and you're in Medicare Part D. And you'll see that this yearly coverage process remains the same. It's been the same as long as I've been doing Medicare insurance. What changes is the amount of money that the government is helping you with. So every year, CMS determines what is the cap or the max a private carrier can charge you for a deductible. In 2024, that was $545. You may have heard neighbors, friends, or loved ones talk about they go to the pharmacy in January and they have very high out-of-pocket cost. This is because you are 100% responsible for your prescription drug cost until your deductible is met. Now, CMS allows each insurance carrier to determine how much of the deductible they're going to pass on to the consumer. So there are Part D drug
I'm
plans.
listed as a member, see it? Alan,
What do you want me to do?
There you go. Sorry about that.
Sorry about that. Okay, so, let me see where it was. So you could have a $545 deductible, but private carriers may have a $0 deductible as seen on the screen, or in some plans, the deductible may not apply to certain low cost or generic drugs. For today, we're going to say you had a deductible, you met your deductible in January, now it's February, and you go to get your prescription drugs covered. There's an initial coverage stage. This is where you're paying a copay. So let's read this. You pay a copay or coinsurance. Your Medicare Part D plan pays the rest of your prescription drugs included on your plan's formulary or a list of covered medications. So we're going to say you have a very expensive drug at $1,000 a month. You paid that $545 for it back in January, and now you're in February, and the government has a set aside for you $5,030 as a subsidy. So when you go to your drugstore to pick up that medication, we'll say your copay is $50 for that drug. So who pays the other $950 if the retail cost of the drug is $1,000? Well, the money set aside in the initial coverage stage of $5,030. So using the $1,000 example, in 5 months, you're going to use up your subsidy, which takes you, let's see, if that's February, March, April, May, that takes you to June. So you'll pay your $50 copay till June. Now you go in June to go get the same medicine you've been paying $50 with, and your pharmacy person says to you, okay, Sam, today that same drug is going to cost you $250. That's usually when my phone rings. What happened to my medication? Last month it was 50. It's been 50. They raised the price. Why am I paying $250? Well, the reason is you spent all your money in the initial coverage stage, and now you have to move to the next coverage stage, which is called coverage gap, which some of you will know as the donut hole, hence the picture of the donut. Okay, and now you pay 25% of the cost for both generic and brand name drugs, plus a small pharmacy dispensing fee of $1 to $3. Now you have to spend $8,000 in true retail cost, but you're already at June, so you don't have 8 more months in the calendar year. So you end the year on December 31st of the calendar year in the coverage gap. Now the next calendar year, you start all over in the deductible. But let's say you went through your initial coverage stage money and hit the donut hole much earlier, like April. And let's say you got out of the coverage gap like by September. Then you would move to the very last one, which is called catastrophic coverage stage. Okay. And then you no longer have any cost sharing for the remainder of the year. So this coverage process, the 4 stages, have remained the same for both standalone Part D plans and Medicare Advantage plans as long as I have been doing Medicare insurance. Now, you could be the hero at your next block party or family gathering to explain this to other people, because there's a lot of misinformation. People think it's the insurance company their agent enrolled them in. People think it's the pharmacy. People have all kinds of things, but what it is, it's your individual medications, the tiers of your medications, and the retail cost of your medications. And if you are in the coverage gap in 2024, there's a very good likelihood you will be in it in 2025. Another thing I kind of tell people is the really, really expensive drugs have commercials, they have jingles, they have songs. You watch TV, you're not seeing anybody singing about amoxicillin. They're singing about all other kinds of medications that have these very high retail costs. In 2025, we've heard that we can maybe say goodbye to the donut hole. There's not a final ruling on that. But we're hoping that that's closed and we can have a funeral for the donut hole. All right, yearly review of medications. This is how we help you make sure your medications are covered every January 1. If you go to our website, which is madiganins.com, that's the website. There's a printable form button. You can upload this, you can fill it in, you can save it, you can mail it back to this address. And please don't forget to put your name on it. And if you want us to call you and you're not a current client, we'll also need a phone number or an email. Let's talk about Medicare Advantage plans. So if you look at the circle for part, and we're back to parts, if you look at the circle for part C, what do you see? You see a combination. You see the bed, you see the stethoscope. So it takes Medicare Part A and B, puts it in one card with a healthcare plan, and then with or without a prescription drug coverage. So who might get a Medicare Advantage plan without a prescription drug coverage? That might be someone who has veterans benefits because they're getting their medications and they're being compliant by getting them with the Veterans Administration. Again, Medicare Advantage plans are offered by private insurance companies, and these are the plans that include additional benefits like routine vision care, hearing, wellness service, over-the-counter products, and a 24-hour nurse phone support line. To be eligible for a Medicare Part C, again, you need the key to the car. You need an original Medicare Part A and B card. You must live in the planned service area, and your eligibility is not affected by health or financial status. So you might be asking, what is a service area? That is your county. So within your county, these are priced and sold and enrolled by zip code. So I live in the Huntley zip code, which can be both Kane or McHenry County. So depending on the residents where their house is located, they could be in Kane County or they could be in McHenry County. And if they choose to enroll in a Medicare Advantage plan, we have to make sure that we're enrolling them in a plan that's contracted for their county. If you move out of your county, you need to change your plan. So plan premiums and terms change from year to year. Everybody needs to still be paying the monthly Part B premium. You have one ID card. Many plans include prescription drug coverage. Coverage is often limited to the service area unless it's an emergency. And I'll pause there and say for the greater Chicagoland area and most of Illinois, that is not a true statement, meaning that there's a lot of service areas and it's not limited coverage. If you're in a certain type of a plan, you may be required to get a referral. And many of these plans, like I said, offer additional benefits not covered by Medicare, like dental, vision, hearing, and preventative care. So what are the types of Medicare Advantage plans? And remember, the Medicare Advantage plans are managed care plans. You have HMO plans. You have preferred provider organizations, PPO plans. I'd like to expand a little bit on PPO plans because there's 3 different types of PPOs. You have a local network PPO. You have a regional network like multiple states like Illinois, Indiana, and Wisconsin PPO. And then you have national networks. And one of the biggest things that has improved with Medicare Advantage over the last number of years is that the preferred provider organization has expanded to a national network. So the client that lives in the 55 and older community near me, if they have that home in Arizona or Florida and in Huntley, Illinois, and they're in a national PPO, they're in network the entire time, regardless if they're in their other state or if they're in Illinois. Medicare Advantage plans have improved with something called special needs plans. These are based on chronic or critical healthcare needs like COPD, diabetes, congestive heart failure. And then there's also one financially. It's called a dual eligible plan. And that is for clients that qualify for both Medicare and Medicaid. Health maintenance organizations with a point of service, that's an HMO that gives you some out-of-network plans. and private fee-for-service plans and medical savings accounts, which you have to qualify for medical savings accounts. All right, we'll spend a little bit more time here on enrollment, because if you don't jump into your enrollment at the right time, it could cost you a penalty. So let's spend some time talking about enrollments. These are called election periods. The annual election period is every calendar year from October 15th to December 7th. You can, let's say you've got a January birth date that you're turning 65, so you can enroll for the very first time in Medicare, or you can review your plans and enroll in a new plan. So a lot of people think, well, once I'm enrolled in Medicare, I never change it. That's not true. You can review it and you can make changes one time a year between October 15th to December 7th. If you make that change, your new policy does not go in effect until January 1 of the next calendar year. The second enrollment period we're going to talk about is called IEP. It's your initial enrollment period. So those of you listening today that are getting ready to turn 65, put your birthday, let's say your birthday's in May, or the number 65 is, and count backwards 3 months. Okay. So that would be when the first time you could either apply for your Medicare card through Social Security. And then as soon as you receive your card, even though you're not 65 yet, you can go ahead and pick the secondary coverage, whether Medicare Advantage or supplement, and a drug plan in the 3 months before your 65th birthday, the month of your 65th birthday, or 3 months later. This is kind of like a golden bubble opportunity, because every single private carrier must take you, no questions asked. You can be very healthy or you can be very ill, and everybody still gets into a plan. And the last enrollment period I'm going to talk about is called the special election period. And there are probably over 36 viable election periods in the special election category. The biggest one is when people move. So you're a resident of Illinois, now you move, let's say, to Florida. That's a special enrollment period because we need to change your plans due to moving. The second special enrollment period that we see a lot of is people worked past age 65. They did not get Medicare Part B at 65. And let me say, you do need to get Medicare Part A. So if you're listening and you're still working and you're over age 65, please go get your Medicare Part A. And that would be, your Part B is covered by your employer group health plan right now, or a union. So now let's say the person's 69 or 70, they're going to leave that employer group health plan. They're going to apply for Medicare Part B. That is a special election called First Time into Medicare Part B. This is our Medicare annual enrollment poster. We have a big 6-foot by 3-foot banner that hangs in front of our building during the open enrollment. It gives you general information about where to find us. Medicare agents do not charge to analyze Medicare supplements, Medicare Advantage, or Medicare drug plans. So all of our consultations are at no charge. So your next steps, if you're getting ready to turn 65, is to apply for Medicare Part A and B at the Social Security, or you could do it online, or you can do it in person. You'll see here it says apply for Medicare. When you get to ssa.gov, there will be a big blue button that says apply. One will say apply for Medicare. The second button will say apply for benefits. If you do not want your Social Security retirement, do not click apply for benefits. Okay, every year we want to review your enrollment period, research your options, ask questions, get answers to the questions. We do work with persons that need financial help. Either they need to talk to somebody like Mooney Lyons about IRMA, or they need us to help them if they're low income to get them the dual eligibility for Medicare and Medicaid. Please make sure you enroll within the given time that you're supposed to avoid penalties, and do a yearly review of all your medications. Here is our information with our address. Our telephone number is 847-457-1802. And we have a lot of good educational material on our website at www.madiganins.com. And I thank Mooney Lyons and Brett for giving me this opportunity today to share some information on Medicare with you.
Awesome. Thank you for your insight, Vicki, and we appreciate you kind of sharing with us kind of how to approach this decision. It's a big decision for a lot of people to make, especially as they approach 65. So thank you everybody for joining the call. Again, we did record this and we will be sending it out. So if you want to take a look at some of the slides or touch base, you can do that through that email. You can also email Vicki directly. Her email is provided here. We'll include that in the email as well. You can also reach out to myself or anyone at Mooney Lyons, and we can introduce you to Vicki that way as well. Thanks again for your time, everybody, and enjoy the rest of your day.
Thank you.